Intervention for sensory overresponsivity focuses on normalizing intense responses to sensory input by first trying to attain a reasonable arousal state using calming sensory input, and second, slowly exposing the child to stimuli which they have a tendency to respond to atypically. The therapist guides the child's responses to be adaptive. The more times the child can respond normally to the stimuli that usually upsets them, the more the brain will tend to respond adaptively by habit when the stimulation occurs in general daily life. In a sense, the therapy retrains the brain to respond normally to sensory input. Two of the most effective sensory tools that therapists and parents have for readying children with overresponsivity to maintain a controlled arousal state are: number 1, deep pressure, and number 2, proprioceptive stimulation. These inputs work because perceived danger activates the parts of the brain responsible for arousal and emotions. Proprioceptive information, that is, sensory receptive information from the joints and muscles, and deep pressure, which comes from the skin, travels to the same areas of the brain and can diminish the danger signals by overriding the signals from aversive sensory input. Here we see Dylan's mother providing deep pressure touch and slow, sustained proprioceptive input, stretching his joints, before he eats lunch, to help him maintain a regulated state prior to eating that should last through the whole lunch hour. A common difficulty for children with sensory overresponsivity is gatherings, birthday parties, family events, including extended family,